Visual recovery after stroke is a big chunk. So there is a big improvement that happens. Again, based on the studies, it could be from 7% recovery, spontaneous recovery, to 80% of recovery. Again, it's a wide range, hard to pinpoint based on the prior observational studies. But typically 30% of patients, in my experience, could recover after a stroke. And around 16 to 20% of patients could have permanent visual deficit. The rate of recovery goes like this. So in the beginning, you have a rapid recovery, especially in the first 3 months or so. When you have acute insult, your brain swells, and then there is a dysfunction of the neurons. So that all lead to the initial disruption. Even though you don't have 100% damage, you present like 100% damage. There's a lot of cytotoxicity happening in the brain. There's a lot of swelling. So people usually present with more deficit in the beginning. So within the first 30 days or so, there's a rapid improvement in those patients. And again, that recovery kind of started to slow down at 3 months, and then at 6 months. By the 6 months, most of the spontaneous recovery happens, and after that, it's kind of plateaus out after that. After that, actually, there are studies that shows actually degradation of vision, because once you hit the nerve, there is a process called retrograde or anterograde degeneration of neurons. So these are postsynaptic neurons that get affected after a damage to the presynaptic neurons. So then after 6 months, you may start having decline in your vision because of that pathology.